Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana Harinsky if you're new here, and if you're not, thank you for coming back. Today is Thursday, October the 6th, and today I am joined by UAB professor and endowed chair, Dr. Kevin Harrod. And Dr. Harrod is here today to talk about the upcoming flu season. Now, I know that is not something that everybody probably immediately jumps to listen to, but we've got a lot of questions here that we're going to get answered, a lot of things that you're probably asking your friends and your family or going to Google for, which we know is not always the best place for medical advice. Dr. Harrod, there's a lot here that we can break down. And again, I know that you are with UAB, professor and endowed chair there, and do a lot of research. So you have been doing a lot of research on both COVID and the flu. So tell us, what can we expect for this upcoming 2022 flu season?
Well, thank you very much for having me. Of course, it's always difficult to predict what the flu season is going to be like, and that's one of the things that makes it most frustrating for those of us in the field and who are looked to for advice. But the early predictions are that it looks like to be a more severe flu season than we typically see for any number of reasons. And so we would like to encourage everyone to seek out their healthcare professionals and get vaccinated for the flu really as early as possible because we may actually have an early flu season this year.
So you say early flu season, which brings me to the first question I have, which I think I've already got somebody asking here in the comments, and that is about the timing here of flu shots. So I have heard people, and I bet you've heard people as well, say, well, I want to get my flu shot at the best time to maximize my coverage. We know that the flu can last through the cold weather season and sometimes into early, even early spring, sometimes winter and spring of the next year. So it's currently October. I almost said September. Currently beginning of October. Is it too early to get a flu shot, or should you go ahead and do it and then just hope for the best?
No, it's not. I have got my flu shot on Tuesday, so it's not. I tell people it's like timing the financial markets. It's virtually impossible. Even the professionals can't do it. And the same thing is really for the flu season. It's really difficult to time it. We know the immunity can last several months. So I would encourage people to go ahead and get it done now, particularly before the holiday season sets in, as that's when we will probably be mingling with the most people, people maybe, that we aren't mingling with on a regular basis or what have you. And that's when the spread starts to happen. So I really think everyone, should consider going ahead and getting this now or in the next few weeks. And that would give them optimal protection through the holiday season and then all the way into the winter. Because we don't really know when the flu season is really going to peak, but we're already seeing states in the South that are already seeing elevated influenza levels.
Which does seem kind of early for our flu season. Now, I've got a question here from Adrian. He says, what if I've never had the flu? Or if I did have the flu, I never noticed it, meaning it probably wasn't bad enough to seek out medical treatment. If that's the experience you have had previously with different flu strains, should you still get a shot?
Absolutely should get a shot. That first off, I think we've all become experts on respiratory viruses over the last, 2.5 years. And we know that just, you can actually come in contact with viruses and not really come down with any symptoms. And these would be what we call self-limiting asymptomatic infections, yet they happen. So nonetheless, whether you've never had it or you've never thought you've had it, you almost certainly have. That doesn't necessarily mean you're protected by the strains that are circulating this year. As flu, as we've seen with the coronaviruses, the viruses are already always evolving. And so there are just times when you will need additional protection that vaccines can provide.
I want to talk a little bit more about vaccines, specifically about a COVID booster here in a minute. But I've got a comment here from Tammy. She says, I had the flu in 1995, and every year since I've gotten a flu shot and not had it again. She said she was knocking on wood there. But, there are people kind of the opposite of Tammy, doctor, that do get a flu shot, but yet still come down with the flu. Is that a reason to not get vaccinated? Because you say, well, I've gotten the shot, it didn't work.
No, I mean, there are some years where the vaccine doesn't match real well to the strains that circulate. The decision on how the vaccines are going to be formulated is made, actually in the spring. We wait to see what viruses circulate in the southern hemisphere. We're seeing what viruses circulate in the previous year here in the northern hemisphere, and then a decision is made. That decision isn't always right, and there are strains that emerge that we couldn't predict. And so there are those years where people get a flu shot, it's a different strain, or it's not a good match for whatever reason. Or we've also seen, as we've seen with the coronavirus, that you could be vaccinated and still catch the virus. But that probably, the vaccine probably did help you clear the virus faster, probably alleviated your symptoms faster, and kept you from developing very severe disease, which is always extremely difficult to predict what would have happened if you hadn't got the virus. So I think, I think it's imperative really that everyone get the flu vaccine. It's important for also reducing transmission, as we have seen, and with the coronavirus. So that's really not really a reason not to get the vaccine. In fact, I can't really think of any good reasons not to get the vaccine.
Well, you brought up COVID opening the door here, and I've already gotten a lot of questions about the COVID booster. So we've heard a lot about this new booster that has been
Right.
approved for people to take. It has not been approved for the certain age group that we've seen some of the boosters or certain health conditions. It's been pretty approved for adults, and that has been pretty much the guidance there. So tell us a little bit about that, and tell us if it is safe and advisable to get that booster along with a flu shot.
So we probably have more safety data on these coronavirus vaccines that we've all been getting over the last 2 years than probably any vaccine ever put out. I really can't emphasize enough the safety that comes with these vaccines. Yes, you'll see news reports and things like that from incidents, isolated incidents, and things of that nature. But nonetheless, these are extremely safe vaccines. The reason for the new booster, as we're all hearing this, and we all get to watch on the news, every day, is the virus is evolving. There are new variants emerging, and that the vaccines that we were getting, last year and the year before, even really aren't as protective as they could be. And so they're updating the vaccines to offer better protection. So I highly recommend that vaccine as well. It's important to note you can get the vaccine, the flu vaccine and the corona vaccine at the same time. That's very important. And for some people, that's, if you have a difficulty in maybe getting out to a healthcare clinic or professional or whatever, it might be beneficial to get both at the same time. Importantly, if you get the flu shot, you cannot get the coronavirus vaccine for at least 2 weeks. So if you're going to if you just for whatever reason get up in a situation where you get one, you'll have to wait 2 weeks to get the other. So that's important to know. That's just so that any symptoms that develop are related to one vaccine and not either or. Excuse me.
That's very interesting. So you can get them together, but if you don't get them together,
Yeah,
then you need to wait several weeks
two
between
weeks.
vaccines.
Just
2 weeks.
2 weeks. Yeah, 2 weeks.
That's interesting.
It's
That's
Yeah, and so in my case, I got the flu vaccine on Tuesday because it was offered to me conveniently. I got it uh, here at UAB Hospital. I'm ready for my next coronavirus variant booster. I'm going to wait 2 weeks and get that, and then get that as we get closer. In the case of the coronavirus, we have you can read any reputable news source, and they'll tell you what the local rates are like, and the rates have been dropping here, although we expect them to go up over the winter months again. So again, it's imperative that you get that vaccine early so you have optimal protection during the peak season, if you will.
well, and you mentioned
Yeah.
this earlier, but I think it's worth repeating, is that these shots, and specifically we've heard this about the COVID shots for the last couple of years now, this is not guaranteed to be 100% preventative of catching the virus, but it is the purpose of this is to not get to the level of sickness where you have to be hospitalized or pass away from the virus. The point here is not that you don't get it, but the point is that you do not have serious illness from it. And it sounds like that's kind of the same idea with the flu shot as well.
That's right. I mean, the flu shot is intended to protect particularly our most vulnerable populations, those with underlying health conditions, the young, the very elderly. Those are really the people that suffer disproportionately from any of these respiratory viruses, whether it's flu or coronaviruses. And the protection the vaccines offer are, again, not only to protect the vulnerable population, but also to minimize transmission of disease in the generally healthy population. So it's critically important that people get these vaccines, if not for their own health, but also for the health of those around them, particularly those who have underlying conditions or are very young, very elderly.
Got a question here from Todd, and he wants to know about the COVID shot specifically. And he says, "Can you tell us if it is still under emergency use, or has this been fully approved by the FDA here?"
That's a good question. I know the original vaccines have been fully approved. I don't know about the new variant booster. It may be under emergency use. I can tell you that I've seen a lot of the safety data on that. It's going to be approved, in my opinion. That's just my opinion, but I see a lot of these sorts of things in my line of work, and I think it's going to be, a very good, very useful vaccine. It may have to be updated fairly frequently as the coronavirus variants are emerging really quite quickly. With the flu, we've had many years of understanding how quickly the variants emerge, and it's generally very seasonal. Coronavirus may end up that way, but it hasn't yet ended up that way. It's not seasonal. We have a summer peak. We have, some places a fall peak. We're predicting a winter peak. So, it may not be as seasonal as influenza. We'll just have to remain to see. But in terms of the safety of the coronavirus variant booster that we're all encouraged to get now, the safety on it is really quite good.
We know that the last couple of years, the flu season has not been as bad as we have seen prior to the pandemic. A lot of people attribute that to the public health mitigations that people were taking in order to lower the risk of coronavirus. So think masks, social distancing, staying in more, not going to crowded places, making sure that our hands are clean, not touching our face, things like that. So you look at all of those public health measures that, again, a person can infer kept the flu rates low as well over the past couple of years. Is that something that should be employed again during a bad flu season?
Yeah, that it's a really difficult question because it kind of goes beyond just standard healthy practices and what have you. Because these things have an impact on our lives, they have an impact on our society, as we've seen. I mean, all the economic crises and things that we're dealing with, the inflation that we're dealing with is largely COVID driven, right? A few other geopolitical issues are involved, but largely it's COVID that's driving that. So these are really difficult considerations when you think of the kind of global aspects of this that go just beyond healthcare. When you just focus on the healthcare aspects of it, yes, it works. Masking works. Social distancing works. Staying out of crowded places. Good hygiene. Washing your hands. All these sorts of things. They all work, and that's almost certainly why we did not see a flu season. There's really been very little scientific data to suggest that coronavirus, for whatever reason, protects us against flu. There is some opinion that one of the reasons that maybe we've had a lesser flu season is that we've been all getting vaccinated against the coronavirus, and that vaccination has elevated our immunity against influenza. I haven't really seen any concrete data or science related to any of that, but that's certainly a plausible idea. I think it has more to do with just our social practices during the pandemic, and that we've just shown that these sorts of things are important for mitigating the transmission of another respiratory virus. And so, because many things were put into place before the flu season got started, it never really kind of got to its seasonal peak. So, I'm not going to really render an opinion in terms of whether we should do all this again, because I'm like everybody else. I'm tired of the masks, and I'm tired of, all the inconveniences that come with all this. But nonetheless, there are certainly some health benefits to all this, and I think we all have to just use common sense in some cases. I mean, going into extremely crowded places when you've been hearing on the news that the transmission rates and the amount of virus in your community is really high, that's probably not something you should be doing at that time. When the amount of virus that's circulating in your neighborhood, your part of town, your city, what have you, is low, you probably get away with a little bit more. So, but then that also pretends or portends that you are healthy, that you're not living in a household with people who are not healthy and do not have underlying disease. Those are all considerations that one individual has to make with regards to what practices they're going to embrace and things like that. I hope that kind of answered your question. It wasn't a very definitive answer, but I think there's some things there to consider.
Well, I think that you make a good point. That is more of a societal question than a medical question. There is not a medical question as to whether if masks, social distancing, things of that nature work in terms of stopping the spread of these viruses, but it is what we are willing to put up with as a society. So I think that's a good point there, is that is not something that necessarily a doctor can say what we should or shouldn't do. They can say, well, we know what the evidence suggests. So
And we have these things to our we have these things available to us. And if you feel better in a certain setting to wear a mask, then absolutely wear it. I mean, I think we're learning to come to accept this a lot more. And if you've seen this in other cultures, they're a lot more accepting of these things because they've seen the benefit of them.
it's funny because we look at how much our perceptions of these things have changed over the last few years. I remember just before the pandemic started, I thought I had the flu. Maybe I did, maybe I didn't. And I remember going to my doctor, and then when I left, they told me I needed to wear a mask out of the office and down through the parking deck into my car. And I remember just
Mm.
feeling so self-conscious about that, thinking, oh my gosh, I'm wearing a surgical mask. I am not a medical professional. I shouldn't be wearing this. I
Yeah,
look weird. And I just remember that self-conscious feeling of it. And then fast
yeah,
forward several months later, and it was the complete opposite. Everybody expected you to have a mask on in most
right,
situations. So
right.
it's funny how our perceptions of those things shift, especially, I
Yeah,
don't know that it's fair to say post pandemic,
mm,
but at least after several years of the
right,
pandemic here.
right.
Now, what about people who are maybe starting to feel a little bit sick, starting to not feel their best? How do you know if it's the flu or COVID? Should you get a COVID test? Should you go
Yeah.
out and go into the doctor's office? What is your advice there?
Yeah, so I mean, I think this is something we're going to see much more in our society. We've got these great COVID tests now that are relatively easy to use, and they're fairly good, in terms of their accuracy. The tests aren't really the problem. The problem is whether you have the virus here in the end of your nose, which is where you can stick the Q-tip, because if the virus isn't there, the test is going to be negative. So I tell people in my circles, and I think this is generally fairly good advice that you'll read about on CDC websites and what have you, is that if you're starting not to feel well, if you have access to COVID tests, you should take them. And just at least educate yourself on what you think you have. A negative test doesn't mean you're negative. You still probably need to take many of the precautions. A negative test means you might have the flu or some other virus, and those viruses cause disease in not only yourself, but they can be transmitted to others with underlying health conditions or what have you, and could cause disease in those individuals. So you really should take many of the same precautions. I think we're, as a society, finally coming to grips with the idea that we shouldn't all go to work when we're sick. I know that's very difficult for some. So for some people, that's a very difficult decision. But for many people, it used to be a sign of devotion to your job and to your career if you just went to work not feeling well. Now, it's not like that anymore. I think we've come to a better appreciation for how we should react in those situations. So I just people just use the same level of precautions that you would with the coronavirus. Stay home. Working from home is easier than it used to be for some. Um, use precautions. Maybe not socialize or be around others if you're starting to feel symptoms. Wait till your symptoms abate for 24 to 48 hours, and then you maybe and then wear a mask. Right. Again, this is something we accept a little bit better. So it can be still difficult to figure out whether what your symptoms you're dealing with are viral infection. They could be there could be allergies for those who suffer from allergies, and there is a robust allergy season in the fall here in Alabama. There's some people that deal with that. So I just tell people, many of the same precautions are just common sense, and we should invoke those when we're not feeling well. But I think in particular, the idea of just going home, staying out of the public. If you have test kits, test for it. I suspect in the next few years we'll be seeing flu kits as well. People have seen the advantage of knowing, what it is that you have.
It seems like so many people's favorite time of the year is fall and going into the
Mhm.
holidays, the cooler weather, all of the different and fun holidays coming up, the gathering with family and friends. The downside there, again, as you mentioned, is the potential for a flu season, potential for a surge in COVID cases. So it's
Yeah,
important that we try to make sure that we keep ourselves healthy and equally as important, keep the people around us healthy. Dr. Kevin Harrod, thank you so much for all of your advice today, all of the information here that you have given us about the flu and COVID. We're going to link all of these resources as well in our comment section here and on AL.com so you can find that. Again, Doctor, thank you so much for your expertise. Everybody
sure.
watching, thank you so much. We'll see you
Thank you.
tomorrow.